This is Aging by the Bay, here to provide families in the San Francisco Bay Area pertinent information about healthy aging practices and services. Your hosts are Ajay Saini and Tom DeZao of ComForCare Home Care.
Good morning and welcome everyone to Aging by the Bay, where we provide families in the San Francisco Bay Area relevant information about healthy aging practices and services. I am Ajay Saini from ComForCare Home Care. With ComForCare, you can give your loved one the best life possible, thanks to complete in-home care for every stage of life. Find out more at ComForCare.com or call us at 800-886-4044. At Aging by the Bay, we talk about joys and some of the challenges of growing older in the Bay Area. We talk to experts about what they see happening as people age, as well as the services that are available that you or your loved ones may not be aware of. First of all, I want to thank our sponsor, A Love for Seniors, who specializes in helping seniors find residential care homes, assisted living facilities, and memory care assistance. You can contact them at 1-800-850-9102. Their website is www.aloveforseniors.com. And again, their number is 1-800-850-9102. So we keep having all the guests from different industries related to healthcare, and also experts who can help seniors in the Bay Area. And today is the last show of the year. And I have with me our host, whom you've been hearing for a long time, Tom. So good morning, Tom.
Good morning, AJ. How are you today?
I'm doing great, thank you. How are you doing?
I'm doing well. We're winding the year down here at the end of December. This will be the last show that we broadcast for 2019. Mm-hmm. So I'm ready to go for 2020. But I think we have some loose ends that we probably need to tie up today and talk more specifically about home care today. Right,
absolutely. Yeah. So one thing that we have noticed that a lot of times families are unsure, especially when the kids come and say, that they are unsure what kind of help and all those kind of things in terms of with their seniors, that what they need. That's kind of sometimes the starting point. So maybe we can help people out there by giving some, what are the signs and signals where kids can realize that there is a need for home care.
Sure. So I guess the first question I would have around this is, the big question all the time from people is, what is home care? Okay? Mm-hmm. So we probably need to start off maybe by defining what home care is. Do you have a definition, AJ?
Yeah, it's a very simple definition, actually. If we say that people live and they have been living on their own all along, and all of a sudden, when they are struggling with daily routine stuff, what you can call activities of daily living. And that's where home care comes into play, helping people actually living their best life possible in the comfort of their own home, and they can do things with assistance from caregivers who come and help them out.
Absolutely. I think that's spot on. I think that I often describe it to folks as having a personal assistant, if you will, in your home. Right. Where you can stay in your home, you could age in place, and do all the things required of a daily living situation.
Yeah. And just coming back to what are the signs that home care is needed? So for children out there who notice certain changes when it comes to how the parents are living, there are few very good pointers they can look at. For example, is it the case that the parents are struggling to dress properly, or they're struggling with toileting and bathing, or they are unable to prepare meals or need frequent assistance? And sometimes are they forgetting medication? Or it could also be do they require assistance in walking sometimes? They're falling, or they are just forgetting certain things. There is confusion around what they did, what they didn't. Or sometimes their mood and emotions are really changing. They see some kind of abnormal behavior. So if any of those things are coming into play, that's a good sign to evaluate and consider if home care is needed, if they need help, if parents need some kind of help, if they cannot manage everything as they were doing earlier.
Absolutely. And I think there also has to be a level of interaction with the family physician. The family physician could certainly provide some insight as to the mental health of the individual and whether they require, in fact, additional care within the home. But what I would like to kind of touch on a little bit as well is, the categories that we often see as home care providers. AJ, my practice, what I see consistently is 4 categories. The first being the post-rehab situation, where someone has been hospitalized. They've gone from hospitalization to a rehab facility, a skilled nurse facility, where they're receiving, intensive clinical care, and now they're getting ready to be discharged into the home, and they're not quite ready to be self-sufficient in the home, and they need assistance, and that's when we get the call. So that's really the first category. The second category I see is the onset of dementia, and this is probably the category that's growing exponentially here. Probably 70% of my clients have, slight dementia, where the family is starting to become concerned that the individual might leave the stove on if left alone, might wander, those kinds of issues. And they want someone in there to act as a companion to just make sure everything's going to be okay during the day. The third category is respite. And that's where it might be a husband and wife who are home and someone is less capable, and now the other party is probably the primary caregiver, and now it's just enough. It's too much over time, and they require a timeout and a rescue so that they don't burn out.
Yeah, and it also depends on the season. For example, during this holiday season, at times they just want to go out with their friends, for example, or some things they used to do earlier, but they cannot do it now because they have to take care of their partner.
Right? A break in the action.
Yeah.
Right? Absolutely. I hear that a lot is, all I want to do is go shopping. All I want to do is go out and have a drink.
Yeah, or want to go out to a spa.
Exactly, but I need to get out of this house, right? So that's where we come in and we provide some companion care and release the caregiver from their normal, 24-hour, 7 duty. And I would say the fourth category is the companion care, where someone is alone and they're tired of being alone, and they need someone to chit-chat with, someone they probably don't drive anymore. They need somebody to drive them maybe to the store and back, but they just want to have a companion that they can interact with. It's human interaction, correct?
Absolutely, absolutely.
So those are kind of the 4 buckets that I see primarily. Is there any outliers here that you've come across that might be a different category of care or need?
No, actually, you have categorized pretty well. However, we can put certain things into these or kind of, related stuff. For example, fall risk among seniors. That's huge.
Yes.
And that comes like pretty much, we can put it in quite a few of these categories.
Absolutely.
For example, post-rehab, when a person comes from hospital, there is a fall risk because they are not that strong. They are weak. And at that time, the home is prepared and it's, fall-proof, or care, or even with companion care. A lot of times the companion care revolves around taking the person for a walk.
Right.
And then just making sure the person is stable enough walking and is there to make sure the person doesn't fall.
So what we call it, we refer to that as standby assist, right?
Yeah.
Where there's a caregiver always close by so that you don't have to worry about the fall. You have somebody there to aid you in the event that you trip or you become clumsy over something. But certainly that is a primary catalog that cuts across all of these categories.
Absolutely.
The fall risk, big one there. Absolutely. I would say another big factor is on the dementia side. what happens is the short-term memory loss provides a lot of anxiety for the family and for the person who's exhibiting those symptoms. And certainly another set of hands is very, very helpful in that situation because they can guide them, they can calm them down when they become very frustrated, they could redirect them. Okay, that's a big part of that component.
You're absolutely right, Tom. And here I would like to say that sometimes what happens, kids, they say that, okay, you need this help when they see these things, which is true, but also it's a way how to manage. Sometimes it's also about the conversation with the parents. So it's involving them is very important. Rather than telling them that you need this kind of help or whatever, it's like, okay, do you see this? Would you enjoy if you get some help? Would it be better for you if, there is a person who can help you out? Involving them in the very beginning helps, especially when it comes to memory issues, dementia and all, so that when the caregiver is coming, they know that, okay, this person is for my benefit, my advantage, and I am in. Rather than even kids, they are forcing that, okay, you need help, here is a person, and the person will take care of you.
So that gives rise to what I refer to as the resistant client. And that is certainly something that we encounter often. I know I do. And that is the adult senior who has been independent all their life. And now all of a sudden there's this new party entering the picture that's going to help them on a daily basis when they don't believe they need help.
Yeah.
So, AJ, do you have any pointers on if you were the children or if you were a family member and you had a resistant family member there that didn't want care but needed care, what do?
I would say the best thing is to involve them. And by involving them, I mean to say that we sometimes treat our parents as if they are kids now, all of a sudden, that we need to take care of them, and we know what needs to be done, and we say, here it is, how this is how it will be done, otherwise it's too risky, blah, blah, blah. Rather than having those kind of things, we need to treat them as adults. They are adults. They have certain things going on physically or mentally, emotionally, but that doesn't mean we stop treating them as adults. We continue to treat them as adults, and once we involve them, we listen to them, we ask them questions, and make them aware, make them realize that if a help comes, it's really a very good thing for them. Once they buy in, the resistance reduces. And sometimes it's a question of just making them comfortable by saying, okay, let's try it out.
Yes.
Rather than saying that, okay, this is how it will be from now on, it becomes more like, okay, let's try it out. Or sometimes it could also be like, say, for example, let's take a situation where dad needs help and there's an early stage of dementia. So rather than telling the dad that you need help, it could be the other way around, that the mom says that, hey, I need help at home, rather than, you need, and then suddenly the person is for me to help out. And then the whole situation changes, because then the dad is not seeing that, okay, I am kind of in any way not managing, and the person comes, and if you get a good caregiver, the caregiver will take care of, become friendly, talk to the dad, and suddenly dad will love to have that person.
I think that's a great way to go. Often what I use is when I come up against a resistant client, I often use the terminology of, this is a personal assistant for you, okay? And that takes the burden away from thinking, oh, this is a caregiver, I must need care, okay? So we try and move away from the verbiage there and put a title on it that is more appealing, I think.
More appealing, and basically we empower the person, saying that, okay, you are in control. You have an assistant, you will use that person. It's not about that your control is taken away. It's like you are the in charge, you are the boss.
That's right.
And they feel good about it.
That's right. Folks, I'm here today. This is Tom. I'm talking with AJ. We are both owners of home care agencies. ComForCare is the name of our agency. We're in the Bay Area here in the East Bay, and would like to thank our sponsor, A Love for Seniors. They are a home placement agency, and so we'd just like to thank them. But today we're talking about home care and the need out there, and some of the things that we do and how we approach a home care situation. So, AJ, what else is important in this whole process for a potential client to understand about home care?
Yeah, I think another important aspect is that once the family and the people involved, they have decided that they need home care, the next step comes, how do we choose a provider of care?
Absolutely.
Because there are so many out there, and there are quite a lot who are very good, and unfortunately there are some who may be cutting some corners.
Right.
So how do we identify what are the parameters, what are the benchmarks that can make us feel comfortable that, okay, we are kind of getting a quality of service?
Sure. And, the first thing I start off with folks that are new to the game is that we are a licensed agency. Okay, we're licensed with the state of California. Our caregivers are registered with the state of California. In order to be registered, there's background checks. There's FBI, there's DOJ background checks. They're TB tested. And what they go through a process is called LifeScan. Okay, and that LifeScan goes to the state, and the state evaluates that caregiver and then gives us the stamp of approval before we could send them out actually working for a client. So I think that provides some validity there to families and some some confidence that they're not dealing just with anybody off the street here, but these people have been vetted.
Vetted, and then the other important part is workers' compensation insurance.
That's right.
That's extremely important, right?
That's right. Absolutely. Workers' compensation and liability.
Yeah.
Okay, that these are all additional benefits that we provide to our clients so that they don't have to worry in the event of a caregiver getting hurt on their residence. Mm-hmm. Right? It's
huge. It can be a big thing. We may cut corners. We may get a caregiver who doesn't have workers' comp, and suddenly something happens, and the caregiver files a claim, and suddenly the client will be responsible, but not with a licensed agency.
Right.
So that's a very good point. And I'll come back to like the earlier topic you were talking about, dementia, because that's so important. The other benefit of having a licensed agency is also that we go through a process called orientation and training of the caregivers.
Good point.
Because that can be a game changer because they are trained how to deal with people. And I can give an example. For example, a client is very resistant, doesn't want to take shower. So in that case, if a caregiver is trained with dementia patients, he can pretty much say the caregiver, let's not talk about shower, and can change the topic, make the client very friendly. They can start singing, playing, start doing things that the client likes.
That's
and
right.
All of a sudden after that, in an hour or so, they say, how about taking a shower?
That's right.
And
it's
suddenly
called
become an
redirecting.
activity, right?
Yeah, it's called redirecting, and that's certainly a component of what we do. It's a good tactic to use when someone is not ready to do something like a shower.
Yeah.
Right.
And it's basically involving them. Again, it's like they are not like to be told that this is what we'll be doing to you. It's more like, let's do it together.
Right.
And in that, they are trained with like very small, common sense things, but they are very difficult unless you are trained. For example, we are taking a shower, but I'll need your help. Will you help me doing this?
Right.
Suddenly, there is an empowerment thing. The client feels, I am in charge. I am doing it.
Right.
Even if you're cooking, it's not about like, okay, I will need some help in cooking, and I would like to go by your recipe. Can you help me? What do you like in terms of salt or this pepper or whatever?
Right, exactly. So I think these are important elements, and really the key take-home message is that caregivers are trained. They are going through an orientation period. They are being trained for that specific client, whether it be a dementia patient, whether it be a respite client, but certainly we adapt to the client need. And that's the important element here.
Yeah. And another important topic when it comes to picking an agency that I will say that if I am taking care of my loved one, what I need to see is that the agency is acting in my interest or my parent's interest. And that comes down to individuals, like the owner of the agency, for example. Caregivers, sometimes in the industry, they come and go.
Yes.
But the point is, if there is anybody who is saying everything will be rosy all the time, and there will be, for example, no-show issue will not happen, or the caregiver will never leave, those kind of things, if they're saying it's too good to be true. The fact of the matter is we are working with humans on both sides. So the key thing is the owner on my side? In that case, if the agency is taking care of the client as they would take care of their own family, it becomes a different ball game, because in that case, no matter what the issue is, the agency will be there to help out.
Sure. And so there's quite a bit of involvement in this. I know as an owner, I'm certainly involved in this process. Mm-hmm. I go out and I do the visit. I do the assessment sometime. So you're not dealing with a marketing and sales person. Yeah. You're dealing with the owner of the company, right?
Exactly. And I just give an example. Like on Christmas Eve, there was a caregiver who was supposed to be going to a client's home, and there was an emergency. Caregiver called and couldn't go. And I knew that the client had a doctor's appointment. So rather than trying to find an alternative backup caregivers, which I had, but I just thought, let's not waste time because the client needs to go to the hospital. I dropped everything I was doing. I just went to the client's home, picked the client, took the client to the doctor's place, and the client was so happy.
I applaud you on Christmas Eve.
So it's just, we need to do what needs to be done.
That's right.
Because that's exactly what I'll be doing if I am dealing with my parent, my family. Right. So that's very important in picking a home care agency.
No question about it. It's the compassion gene that has to be identified here. And for the most part, I think people involved in home care are compassionate people. Mm-hmm. And they will drop what they're doing if an emergency occurs or a requirement is present that they need to take care of. I think that it's important to understand the client's needs and convey to them, communicate to them that we will be here to take care of those needs.
Absolutely. Absolutely.
So in winding down now, AJ, any take-home messages that you would like to convey to our listeners today?
Pretty much like, what we discussed, it's about not getting overwhelmed, because it's a very natural thing to get overwhelmed when it comes to seeing our parents struggling or even seeing our partner struggling. And then we say, okay, what do we do now? There is help out there. Just go through the process. And once you start and you pick the right agency, they will be there to help you. They will be in your interest. They will make sure you lived your best life possible.
Sure. And I would just add to that, one of the apprehensions that I often see with potential clients is the expense proposition. Because home care is not covered by insurance unless you have a long-term care policy. Mm-hmm. People often balk, but you should remember that we have 4-hour minimums. Okay, so you don't have to do a full day or a 24-hour 7. You can do as little as 4 hours a few times a week.
Yeah.
And certainly that reduces the cost burden, if you will. But you're getting some help, which is often important in the beginning.
Yeah, that's a very good point, because sometimes it's a case of taking shower. It's better a person is not taking shower rather than taking twice a week.
Right.
So in that case, and that can be a critical part in terms of avoiding a fall and all that. And even if the caregiver comes twice a week, and then the family can evaluate, see the difference and see the value of it. And down the line, they can see and take it from there.
Absolutely. Well, I think that's it for today, AJ. And we wind down 2019. It's been a great year. I think that's it.
Yes, and I would say, Tom, in advance, Happy New Year to you, and also Happy New Year in advance to all our listeners out there.
Very good. Same to you, bud.
Thank you. So, thank you for joining us on Aging by the Bay today. This show was brought to you by ComForCare and a love for seniors. This weekly show provides information that helps our seniors age better. Please visit our sponsors' website at www.aloveforseniors.com. You can contact them directly at 1-800-850-9102. We hope that you enjoyed the show, and please subscribe to our podcast that is available at iTunes, Google Play, Stitcher, and SoundCloud. You can find the show and also previous shows at our website, agingbythebay.com. We love your feedback, and so please leave your comments. If you have any question for our featured guests or want to become a featured guest, please contact us by sending an email at info@agingbythebay.com. Again, a big thank you to our sponsors, A Love for Seniors, and to ComForCare Home Care. This has been an Aging by the Bay show, addressing issues on aging and services available for our elderly population. We will be back next Saturday at 10 a.m. Until then, take care and have a nice week.
This has been Aging by the Bay, addressing issues on aging and services for the elderly community. Join us again next week for Aging by the Bay.